All right, everyone. Well, welcome. It's 1 minute after the top of the hour, so let's go ahead and get rolling on today's session. Thank you to everyone for being here today. My name is Bailey Sterling. I'm the Student Engagement and Marketing Strategist for Region 3 of the Network of the National Library of Medicine. And if you're not familiar with our work, I'll tell you a little bit more about us here in just a moment. Teaching with me here today is Margie Shepard, and Margie is the Community Engagement Coordinator for NNLM Region 3. So we have just a few technical items to cover here. We do have captioning available today. You can click on the CC or closed caption button at the bottom of the screen to start the live stream for yourself. All attendees have been muted, but we welcome your questions and comments in the chat anytime. But please be aware we'll also have time for questions at the very end of the presentation. If you are going to type questions into the chat, please be sure to select everyone from that little drop-down menu in the chat when you're posting in the chat so that everyone can see them. Next slide, please. So we are recording today's session, and it will be available in about a week to review. As a reminder, by registering for this webinar, all attendees have agreed to abide by the NNLM Code of Conduct. It's a reminder that we are all here together professionally, and we want to be inclusive and respectful. Your cooperation is appreciated. This class is eligible for 1.5 Medical Library Association continuing education credits and qualifies for MLA's Consumer Health Information Specialization, or CHIS. You can also earn Illinois Continuing Education for Nurses, or CNE. And this class has also been approved for Certified Health Education Specialist, or CHES. We'll share an evaluation link with the CE information at the end of our time here together today. When you complete that evaluation, you'll receive a CE code for your credit. Your feedback, though, helps us improve future events. So please do, we do ask that you please take a moment to complete that survey, whether you want the CE or not. But we will provide that link at the end of today's session. Finally, we do have a worksheet that accompanies today's class. We will link that worksheet in the chat here shortly, and we will also have a link for today's slides. Next slide. So I promised I would talk a little bit about NNLM. Some of you may already be familiar with us, but for those of you who aren't, I do want to share a little bit of information about who we are. So I'd like to start at the top, so to speak, and work our way down through our larger organization. And at the top in this kind of red partial circle, you see NIH. Of course, NIH is the National Institutes of Health and is the nation's leading medical research agency. Many of you might be more familiar with the National Cancer Institute, which is one of the many institutes and centers at NIH. In the next little half circle down, it's like grayish purplish. We have NLM, or the National Library of Medicine. And NLM is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. In the green kind of half circle, one level down, we have NNLM, or the Network of the National Library of Medicine. NNLM is an outreach program of NLM working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities for over 9,000 NNLM member organizations, and we are so proud to work with each one of those organizations. Next slide, please. So here's a map to show you how our regional medical libraries are geographically divided. If you'd like to learn more about your region and how your organization can become part of the network, please visit our website at nnlm.gov. The link is in the chat. And just for reference, Margie and I both work in NNLM Region 3, which is, it's kind of hard to tell on this map because they're all gradients of blue, but we're in the region that stretches from Nebraska down to Texas and then over to Missouri down to Louisiana. So we are located in Region 3. After this session, you will be able to define numeracy, risk, outcome, benefit, statistics, relative risk, and absolute risk as they relate to numerical health information. Explain risks and benefits of health information from an individual's perspective. Interpret and evaluate numerical health information. Communicate numerical health information to others, and recognize Medline Plus as a resource for numerical health information. Next slide. So just a quick overview of kind of the journey we'll be taking today together. We're in the overview session right now, section of this session. That's number 1 that you see here on this slide. We're going to, excuse me, we're going to start off by interpreting and presenting numerical health information. We'll be talking about that first. And then we'll be moving on to evaluating numerical health information. And then there will be a 10-minute break. It will be a full 10-minute break. And then after that, we'll come back. We'll discuss communicating numerical health information, and then we will put it all together. And then at the very end, there will be just a brief wrap up. Next slide. So let's start off with some definitions, just kind of so that we're all on the same page. For the purposes of this session today, these are the definitions that we'll be using for these terms. Numeracy is ability or knowledge with numbers. Risk is possibility of loss, injury, or adverse or unwelcome circumstance. Outcome is the way something turns out or a result. Benefit is an advantage, profit, or good. Statistics are systematic collection and arrangement of numerical facts or data. And evidence is something serving as proof. Next slide. So I'm going to touch on this briefly here, and Margie is going to revisit these terms later. So bear with me just a moment. There will be, additional explanation of these terms later. So one key concept to understand when communicating risks and benefits is the difference between relative risk and absolute risk. Both ways of explaining risk are accurate, but they're easily confused, and they could really change the way, like the health outcome or a plan for somebody. So an easy way to tell the difference is to think about where the number or percentage or statistic appears in the sentence. And we have examples of sentences here highlighted in blue. When you're talking about relative risk, the statistic is usually in front of the outcome. 50% increase in trouble sleeping is what we see in our example here. Expressions of relative risk also often include comparisons. The 50% increase is relative to a baseline absolute risk of trouble sleeping. With absolute risk, so that's relative risk, with absolute risk, the statistic is usually in front of the population, so 3% of patients. Imagine that you have 2 groups of arthritis patients, and each group has 100 people. The first group of patients takes a new drug, and the second group doesn't take anything. Now, suppose the groups of patients who don't take the drug has 2 people with sleep problems. And the group taking the new drug has 3 people with sleep problems. That's a 50% increase in sleep trouble. But the absolute risk for someone taking the drug is still rather low, at least lower than you might expect if you hear that the drug increases your risk of sleep problems by 50%. Although both ways of describing risk are accurate, the relative risk often makes people think that a treatment is more effective than it is. Relative risk can also make people think that a bad side effect of a treatment is more common than it actually is. In general, talking about the absolute risk can be clearer to patients and to other consumers. And like I said, Margie will cover that in more detail later on. And now I'm going to pass things over to Margie.
Well, thank you so much, Bailey. So the way that we present and how we interpret numerical health data, or I'm sorry, information, is important for each of us. But it's even more important when supporting our target audience in using numeracy to make informed health decisions. So most people have at least a little experience dealing with numbers related to their health or the health of someone they know. To that end, we have a question for you. When you are looking at numerical health data like clinical trial outcomes and health study results, what details should you look for to get a fuller picture? So we're going to give you a little bit of time to think about this and put your responses into the chat. So I'm just going to start that clock now. So think about that. You know, what health data are you looking at when you're examining those the trials or maybe a health study result? Okay, we've got some responses rolling in here. Just give you a few more seconds. I've got some really, really great responses. Okay, well, thank you everybody for your responses. And please feel free to keep typing and communicating your ideas in the chat box. It's really helpful, and we all learn from that. Okay, so to communicate numerical health information really well, we need to ensure that we have a good understanding of how to interpret data. In other words, we should understand what information to look for and how to read that information in various formats. So when interpreting numerical health information from any source, let's consider these following things. First of all, you know, what is the topic being covered? What population or populations are being described? Do the data apply to a specific group or maybe groups? What about a specific race, sex, or nationality? And then consider health history or socioeconomic factors. And what is the geographical area and the time period from which the data is derived? So is there a specific time frame that's covered by the presented data? Is it a year, maybe 5 years, or even possibly over a lifetime? Does data describe something very broad or very specific? For example, when looking at a chart that communicates cancer rates, a broad scope might be cancer rates, but a very specific scope might be stage 4 colorectal cancer rates in women over the age of 80 in Texas between 1990 and 2010. What is being stated about absolute versus relative risk? And what about the benefits and outcomes? So is there an outcome being reduced? And what benefit is occurring and by how much? Or when did the treatment start? And finally, how is the data expressed? Number, percentage, decimal? So these considerations can vary based on the specific needs of you or the situation that you're involved in. So let's explore some common ways that numerical health information is presented, such as fractions, decimals, percentages, and measurements, as well as data visualizations like infographics, pictograms, charts, and tables. So the way numbers are presented can change the way we see and understand data and make health decisions. So numbers can be presented in various ways. So let's take this example. The percentage, 30%, can also be expressed as a fraction, that's 3/10, or as a decimal, 0.3. So all these figures mean the same thing, but the way you express this number may change based on the context. So here's another question for the chat. Which format do you think is the easiest to read and understand if we are using it to convey someone's risk for diabetes? So please put your answer in the chat. Okay. We have a clear winner. Okay, so yes, we don't usually express someone's risk for diabetes as 0.3 as a decimal. 30% or maybe 3 over 10 would be more appropriate. But you also could say 3 out of 10 people. So that might be easiest for most people to understand. So basically, it's, consider the context in the group that you're working with before you make a decision on how to present the information or the numerical data. Okay, so for the next few examples of data presentation types, we will use a fictional statistic. 3% of people who undergo surgery develop a blood infection. So please note, this data point is not medically accurate and is made up. So this fake example communicates risk. So it's a good chance for us to review relative and absolute risk. So which one do you think it is, relative or absolute? Go ahead and put your answer in the chat for us. Okay. All right. Yep, as we get those answers in. Well, Bailey, you did a good job because everybody that said absolute risk, you are right. That's because it indicates an absolute number of the likelihood of an event occurring in a specific population. It's 3% of people who undergo surgery. So good job. Yeah, hooray. Go team. All right, so our first type of data presentation is using text. So this health information appears as words formulated as a sentence. 3% of people who undergo surgery develop a blood infection. So this is one way numerical data may occur. So the text example uses a percentage, 3%, but that can be easily switched to 3 out of 100. So we've already discussed that the decimal, 0.03 isn't as common or as useful to people as a form of data expression. So again, understanding who you're working with will help guide the decision on how you want to present the data. So here's our next type of data presentation, and that's a table. So a table is a type of data visualization. A data visualization is just what it sounds like, a graphical representation of information and data. Visualizations enable us to see data in context and communicate its key aspects more intuitively, persuasively, and memorably. Visuals can make the presentation of complex information not only more attractive, but also easier to comprehend. They can also, I'm sorry, did I? They can also, hold on a minute here, folks. Okay, I'm sorry. They can also reinforce written or spoken health messages. So this table that shows us one way that numerical data in our blood infection example could appear. So you can see that it's pretty clearly written, and it would be easy for people who are much more used to having text as an explanation or a table representation present this information in a clearer way. Okay, so charts are another type of data visualization, and this is a really good example. You see our blood infection data illustrated in a pie chart, and good charts help us visualize data in a way that makes sense. So this pie chart helps us visualize exactly how much 3% really is in comparison with the whole. So we can comprehend risk in a visual way. So examples of other charts and graphs that you commonly see are bar graphs, line charts, and sometimes even scatter plots. So each type of chart and graph has its strengths and can be used strategically depending on what information needs to be conveyed. So we have probably all had an experience with a chart that really made our heads spin. So making them simple and clear will help your health information communication efforts be more understandable. So, this one really brings to mind how small 3% is in relationship to the whole. Okay, so let's move on to the icon array. This is probably my most favorite way of presenting data. So an icon array is a visualization where you have one shape and it is repeated a specific number of times to represent the whole. Then some of the shapes are altered, so in this case by color, to represent a proportion. And icon arrays, they are very useful when communicating numbers because they are easy to understand when used in the right context. So this icon array does a really great job of depicting how many people develop a blood infection in our example. So when using visuals to communicate numerical health information, consider this. So where should you look first? And what path are you supposed to follow through the chart or diagram? And finally, what connections must you make to extract information from such formats? So what I like about this icon array, it shows 3 people highlighted at the bottom, which means that I'm probably going to look at the 97 people who don't develop a blood infection before getting to the 3 that will. And so this might be a really good way to positively frame the data. And we're going to talk more about framing in a little bit. So moving on from our fictional example, let's look at some real world ways that data is expressed. So this table shows numerical health data as measurements. So in this case, measurements of blood pressure expressed as ranges. So other ways to express measurements include mass, volume, length, height, and there's many more. So I want you to think of someone in your life, and looking at this table, would the way that the measurements are expressed be a good way to communicate information about blood pressure ranges to them? So if not, based on what you've learned during the presentation, think about how this table could be improved to make it more understandable. It's always important, though, again, like I've mentioned before, to consider your target audience when interpreting or representing numerical health data. And lastly, let's talk a little bit about infographics. I'm a real visual learner, so I like these. An infographic is an illustration that uses graphic elements to present information in a visually appealing way. So technically, you can probably link lump tables, charts, and icon arrays into this. They are also infographics. However, images like the one on this slide are actually the ones that are more typically associated with an infographic. The infographic here provides a visual representation of risks we can and cannot control when it comes to heart attack and stroke. So this information is generalized to all populations and refers to the standard risk that increases risk of heart attack and stroke. But bear in mind, it does not address a specific population. So within this graph, you'll notice pictograms, or pictographs, whichever you prefer, which are small icons that visually communicate a concept concisely. So we have some of them highlighted and enlarged here in the center. So as you can see, numerical data is well communicated about the age group that's considered at risk for stroke by a green circle with 65 plus inside of that, and that's labeled as age. All right, so let's go ahead and we're going to practice a little bit of what we've learned here. So I want you to take a look at this table and then consider our scenario. A young person is searching for information about iron levels after a recent doctor's visit. They find this table, but they're overwhelmed by the information it contains. So what can we do to help this person interpret the data in a way that might better allow them to get the information they need from the table. You can go ahead and type your answers in the chat. I'm going to give you a little bit of time to think this over, like twice as long as before. And then I'm going to pass things over to Bailey for the next section. But go ahead and kind of think about this, and what would you think would make this more appealing? Great. We've got some really great responses. Yeah, I like, first of all, I think, coloring it in a different fashion would be much better. Representing information in a graphic or an infographic would probably be a lot more helpful, especially for visual learners. And I don't know if milligrams people understand what that is. So yeah, that's great. A chart would be, maybe a different kind of like a bar chart or something else would be a little more, give a little bit, be easier to digest with the eyes. So yeah, good idea. We've got some great ideas. Okay, well, thanks everybody for participating. And like I said, I'm going to pass this over to Bailey.
All right, well, don't put away your keyboards just yet. I'll have a question for you here in just a second. So when you're working with someone who wants to understand health risks and benefits, which to be honest is all of us, it can be good to briefly review some strategies for evaluating claims that they are likely to encounter. So let's look at a process that can be used to help guide your searches and aid in helping others search for and evaluate numerical health information. Next slide, please. So this is, pull out your keyboards again. This is that question I'd like you to answer. So what should you consider when evaluating or helping someone else evaluate health information? And I'm going to mute and pause for 30 seconds. Gosh, y'all are on the ball. Look at all these great responses. Geographic location, data publication, these are all great. Is it a reputable source? You have to consider their specific needs. I love that response. Yeah, these are all wonderful. Thank you so much, everyone, for participating so well. So in this section that I'm about to start, we'll look at 5 points to consider. Oh, next slide, please. Oh, thank you. We'll look at 5 points to consider when evaluating health information. We'll focus on Medline Plus as our example. Medline Plus is a great source of health information intended for consumers, but there are many databases that provide useful, relevant, and accurate information regarding health information. NNLM has many courses on utilizing Medline Plus if you're interested in learning more about this particular NLM product. Next, please. So ideally, information in a journal or on the web should have an identifiable source or an author. This aids you to evaluate points such as authority and purpose. Does the author have expertise in the area they're writing on? Are they drawing on others with expertise? An important clue to the identity of a publisher can be found in the web address. .edu is a web address that if a web address ends in .edu, that means it's owned by an organization that's associated with an educational institution such as a university. An ending of .gov, .gov signifies that the web page belongs to a governmental organization. .com and .org are open to any registrant, with .org commonly, and this is the important part, but not exclusively used by nonprofits and non-governmental organizations or NGOs. So that's important to remember that .orgs are open to any registrant. So accuracy. When assessing accuracy, try to determine whether the information is supported by evidence from scientific studies, other data, or expert opinion. Look for corroborating independent sources that support the information's conclusion. Does it cite external sources? When evaluating its citations, are they reliable? Next, please. Currency refers to how recently the information was published and is especially important for health information, which needs to be as up to date as possible. Consider this. Is the information current? Is it reviewed regularly? What is accurate about a particular health topic can change rapidly, and making sure that the information in a resource is accurate takes periodic revision. Look for review dates on your sources. Often websites will lack a review or even posting dates, which can make evaluating the currency of the content pretty difficult. One of the benefits of Medline Plus, and you can see kind of a screen cap from Medline Plus here on the right, is that the content is regularly reviewed and updated as indicated with the text in the red box on the bottom of the slide. Each page has the date that it was last updated. And if you're not familiar with Medline Plus, this might be a great time to kind of meander over there, medlineplus.gov, and take a look at some of the health information pages on that site. That last reviewed stamp there on the bottom is super useful. So next, please. So let's talk about relevance. Do the facts and figures cited here, cited on the source, back up the claim that the authors are making? Do I know what kind of risk they're talking about? Absolute or relative? Or does that seem confusing? Also, as a general rule, look for agreement between two reliable sources. Experts can be mistaken. We are all human. The results of a single study could be an outlier that doesn't agree with most of the other studies on a particular topic. Using two or more sources that agree with each other makes it more likely that a piece of information aligns with the general consensus of medical researchers and doctors. Next slide. Resources can be made for many different reasons, as we know, and that reason can shape the information provided by that resource. Everything is made for a purpose. What does the purpose of a resource tell you about what the information it conveys is meant to accomplish? Is it trying to promote a particular opinion or behavior or political or ideological stance? Having a clear purpose or agenda in a resource does not mean it's not necessarily a reliable source of information, but it does impact what's presented, how it's presented, and what information is used to support it. Being aware of the purpose is super critical to evaluating a particular resource. Okay, we made it. That brings us to the end of our first section of this session. We're going to do a 10-minute break. So at my clock, I see I'm in Central Time, so 1:36. So we'll meet you back here at 1:46 or at 46 minutes after the hour.
Okay, everyone, I hope you had a nice break, chance to stretch your legs, get something to drink, do a little exercise here and so we can power through the rest of this. So I know some people might be trickling in, so I just want to encourage you all to maybe open up the notes on your phone or on your computer. Maybe grab a piece of paper, pen, pencil, whatever, marker, tube of lipstick, whatever you want to write with, and just take about a minute to answer this question. And this is only for you and for your records, but if you want to share whatever you come up with in the chat, please feel free to do that. So we'd like you to consider what you've learned so far in the first part of the session, and what are the most important takeaways for you so far. So I'm going to mute my mic, and we're just going to give you about a minute to mull this over, and then I'll be back. Okay, so I kind of think we're close to a minute. I thank you so much. There's a couple of really great comments in the chat. So if you want to take a minute to check those out, so using resources that are understandable and effective for educational healthcare management, it's a really good point. And then, health consumers, we interpret risk differently depending on how it is presented. And I really, really believe that's true. As health communicators, using a variety of tools to make the information clear and accurate as possible is important. And then understanding those various ways that we can express numerical information to fit different learning styles. And I really like that you came away with that because, again, we are all individuals and we learn so differently. Okay, so now let's move on into the communicating numerical health information portion. So when we're presenting numerical information, we want people to connect with the numbers for effective and evidence-based decision making. So generally, numerical health information will be used for the following purposes: to inform, so such as when you're talking to people about screenings, and to compare maybe medications, comparing treatments or therapies, and to motivate, think of quit smoking or maybe motivate people to begin an exercise program. So the needs of your audience and level of understanding will shape the format that you will use in communicating risks and benefits or other health information. So as we mentioned, there are a number of ways that numerical health information can be presented to help people understand it. And this includes words, using numbers, charts, tables, infographics, etc. So in this section that we will be providing you with some tips to help yourself or someone to make sense of numbers so that they can be as informed as possible. Use these techniques with everyone, and don't just use them with people that you think have limited health literacy, because I know for a fact that limited health literacy knows no boundaries. Just bear that in mind. All right, so after establishing your purpose, is it to inform, compare, or motivate, you'll need to be clear about your message. So some things to consider when you're preparing your communication is what data needs to be communicated. And is it formatted so that communication is as clear as possible? So what are we looking at? Is it injury, a diagnosis? Are we looking at risks? Maybe even the possibility of death? And how big is the risk? And are there any benefits? So next, you want to use appropriate framing. Studies show that the way we hear and understand health statistics can be influenced by how the numbers are described, and how we present the risk is very important. So you can present risk in a negative manner, focused on a negative outcome, or in a positive manner, focusing on the benefits or the positive outcome. So looking at this statement, more than 20% of Americans will eventually die of cancer might sound less scary from a different perspective if we say nearly 80% of Americans will not die of cancer. The same information might seem even clearer as a ratio. So we might say something like almost 4 out, or maybe not even almost, but 4 out of 5 Americans will not die of cancer. Okay, so let's practice this together. Again, this is not a realistic statistic. We're only using this to practice framing. So how would you reframe the following information to someone? So 4% of people who undergo a particular ankle reconstruction surgery after a fracture develop complications. So I'm going to give you a moment to think about that and respond. You can put that in the chat. So we want to frame this in a different way. Okay. We're getting some good answers in there. Yes, thank you. I really appreciate your feedback because, again, like for instance, some people mention 96% of people who undergo the surgery do not develop complications. I think I saw another response up there about only 4 out of 100 people who have the surgery will need to follow up. So that's great. So the point is, there really is no right answer. But in the context of what the patient's needs are, and where they are emotionally and thinking about the surgery is something to consider. So that's when you might want to be really mindful of the way that you frame a statement. Sharing this information another way, could help someone that needs a surgery but's very nervous about the possibility of complications. Okay, so we're going to talk about communicating risk, and Bailey mentioned this early on. There are two types of risks referred to in healthcare, and that's absolute and relative. So, defining absolute risk, it can be thought of as the probability or the chance of an event occurring in a specific population over a defined period. And it's expressed as a percentage or a fraction. So if we were going to write a formula, it would be absolute risk equals the number of events in a group over the total number of people in a group. So in our example, 3 out of 1,000 non-smokers may have a stroke in their lifetime. If we express that as a fraction, it would be 3/1,000 or 0.3%, while 6 out of 1,000 smokers may have a stroke in their lifetime would be 6/1,000 or 0.6%. So absolute risk provides, this is the word, absolute measure of the likelihood of an event occurring in a specific population. So we have the number, which is 3, and our population is non-smokers, or 6 and 6 smokers. So just consider that when you're thinking about the absolute risk. It actually is, it's really useful to think about absolute risk for understanding overall risk of a disease or a health condition, or when you're comparing risk between different groups or populations, or estimating the potential impact of interventions or treatments. Now, relative risk is the risk of a certain event happening in one group compared to the risk of the same event happening in another group. And this is expressed as a ratio. So the second example that we mentioned here, highlighted in the pink section, it shows the relative risk of smokers versus non-smokers. So those are our two groups of having a stroke in their lifetime. So smokers have 2 times the risk of having a stroke in their lifetime. So we got that information out of the information based on the information of the green box. So if you were going to express that as a ratio, it'd be 6 to 3 or 2 to 1. So a risk ratio greater than 1.0 indicates that there's a positive association or an increased risk for developing the health outcome in the exposed group. So in our example, the risk ratio of 2 means that smokers are 2 times at risk for stroke in their lifetime. So both examples show accurate data, but it's really important to think about how particular framing might motivate people to do something or start working with healthcare providers to improve their health. So let's think back when we talked about decimals, fractions, and percentages. So these are opportunities to choose your numbers wisely. So what we want to make sure that we're doing is always be consistent with number formats and figures throughout an explanation. So we also want to keep our denominators, the time frames, and measurements very consistent. And we want to focus on a few numbers at a time, and the most relevant information should be included in that. Another tip for effectively communicating health information is to use common words and measurements. You don't want to use jargon or technical language whenever possible. Also, avoid long decimals. That's just going to get people lost. They'll be, counting the zeros after that decimal point. And find out which measurement system your audience is more accustomed to using. Is it metric or imperial? It's really appropriate to ask somebody, would you like me to explain using ounces or grams? This is the best way to avoid making assumptions, just to ask people their preferences. So another tip is to describe numbers and define words so they are easy to understand. This strategy is often referred to as using plain language. So make sure to use number formats and phrases that will make the most sense to your audience. So for example, and we've talked about this earlier, say 1 out of 10 times rather than 10%, or use the word, instead of saying, use the word heart attack instead of myocardial infarction. So, and also in some cases, it's easier just to say, or more understandable to say about half instead of 49%. And it can also be helpful to define risk as high, moderate, or low, and what those look like in number form or visually, like our previous example of the blood pressure measurement table. Also, check out Medline Plus as a resource for further information on health topics, word definitions, etc. Medline Plus is written mostly at the 5th to 8th grade reading level, but there are also specific pages that are tagged as easy to read that use very plain language. So do check that out. And finally, the last tip that I have for you is to show pictures. As we mentioned earlier, visualizations are very useful to communicate data. Sometimes using visuals can help people put risk or probability into perspective. So using familiar icons or pictures can be extremely helpful in communicating risk. So this visual stands out because quarters are familiar to just about everyone in the US. The images depict men, which is who this statistic affects, and crosses one of them out, 1/4 of them, to communicate men's risk of dying of heart disease. So I'm going to pass this over to Bailey now. She's going to bring us home here.
Perfect. Thanks, Margie. I really like that quarters example. That's like my favorite example that we cover in this whole class. I think it's really super effective and on the nose. So anyway, all right. So we've discussed interpreting data and all the various ways it can be presented. We've looked at evaluating data and how to communicate data. So now let's put it all together with some practice scenarios. So let's take a look at the scenario here on this slide, and I'm just going to read it aloud. Mary is 48. Her doctor encourages her to receive a mammogram, but she is unsure about what that is and is afraid to ask. She goes home to begin searching for information. She sees online that 13% of women will be diagnosed with invasive breast cancer and 3% will die from it. To Mary, the terms and numbers are confusing and she is unsure how to move forward. How can we help Mary? And I'm going to pause for, let's say, 45 seconds. I'm going to start a timer. Please think through how you think we can help Mary and type those responses into the chat. All right, so what I see here in the chat is let her know that terms and numbers can be confusing and that encourage her to see her doctor. I think that's a great response. Find out information on how screening finds cancer when it's more survivable and share that information. And use Medline Plus. Hey, I love that answer. Yeah, I agree. Utilize Medline Plus. Oh, next slide, please, Margie. We would say that Medline Plus is a great tool to utilize for defining breast cancer terms and processes and to help interpret the numbers. It might be helpful to explain that 97% of people will not die from breast cancer. So we could also say that 97 out of 100 will live. And what you choose to say really just depends on Mary and what Mary's specific needs are. All right, next slide, please. Okay, so here's another scenario. Again, I'm going to read it aloud. Lucy's doctor prescribed her alendronate for her osteoporosis. And I am sorry if I'm butchering that, everyone. She asked her doctor how likely it is that she will avoid a hip fracture by taking this medication. Her doctor responded, if 15 patients are treated, 1 will benefit. Lucy is unsure if this medication will provide a good benefit for her. Can you help Lucy understand the benefit of this drug? And again, I'm going to mute myself for 45 seconds and allow for some responses. All right, so here we see show data visualizations from Medline Plus. I think that's great. Put the number in context and refer them back to Medline Plus to consider risks versus benefits. I think that someone here has a great example. They understand that the lower, and I'm going to be honest with you, I don't know what this means. The lower the NNT, the more effective the medication, but I'm not sure how to communicate that to the layperson. And I think that that's a great point. Sometimes it's really difficult to know how to communicate information to the layperson. And I think that we find that at doctors very often. I can tell you that at some recent doctor's appointments, I was going to a new doctor, I was having to fill out my health history, and they didn't have plain language materials when I was registering for my appointment. So I had to like refer to some health issues, and like I had to figure out what the medical terminology was for it, like the official medical terminology, because they didn't have plain language or patient-friendly materials that were easy to engage with. So yeah, it's really interesting that it's difficult to know how to communicate that stuff sometimes, but I think that's why classes like this, even if you did already know some of this information, kind of getting a refresher and being well versed on how to communicate sometimes complicated information like numbers to a broad range of people can be really helpful. So thank you for that. Next slide, please. All right, so, oh, and here, sorry, here's the solution slide for this. Breaking down the numbers differently, I think y'all covered that, and then referring to Medline Plus, of course. But as we mentioned at the top of this presentation, there are other websites that also offer great health information, but we know that Medline Plus is fully vetted, it's up to date, so we certainly encourage folks to use that. I use it in my day-to-day life as well. All right, next slide. So we've covered a lot of ground. And we hope, Margie and I hope that you're feeling more confident in your numeracy and your evaluation skills. So some final points to address as we wrap up. Before you can communicate data, you need to ensure that you yourself can interpret it. When you're communicating with someone about risk, we've talked a lot about risk today. So when you're communicating with someone about risk as it relates to health or medicine, it's important to provide context to the information you're sharing. Be clear about the message, properly frame the information while using absolute risk wherever it's possible, limit numbers, use common words, describe what numbers mean, and show pictures. Your particular needs and situation will determine the format you'll use in communicating numerical health information. Always have the needs of your audience in mind. And I will say that if you take away one big lesson from this entire class, it would be please do always consider your audience, because what might work with this person right in front of us now may not work with the next person in line who has a question for us, or may not work for us moving forward. So, you know, the audience is really the most important part of this equation. Next slide, please. Okay, so I am going to pause here for just a few seconds. If you have any questions, please feel free to type them into the chat, and we will be happy to address those. And thank you for defining NNT. That's very helpful. I appreciate that today. Thank you for teaching me something in the class that I'm teaching. I appreciate it.
Me too. I didn't know that. So thank you. Just to piggyback onto what Bailey said at the end, I'm not sure who you'll be sharing this information with in your practices and the people that you engage with or support, but this is really good information to share with, especially with nursing students and residents or medical students, because, you know, it's one of those things about health literacy as we're trying to provide information to people in a very short amount of time, you know, keeping it simple is probably a good advice for anyone that's out there doing interacting with patients or teaching, and remembering the stressful situation that people are in when they're encountering the need to have health care. So share this out there with your the people that you support.
I have to tell you, I was very fortunate to play a hand in developing this course many years ago, and it has really helped me in communicating with my aging grandparents, especially my grandmother. It has helped me to like understand how to better help frame information for her that would under other circumstances be pretty difficult. So yeah, thank you, Margie. We do hope you find this very useful. And we hope you've enjoyed it too. We know it's a lot of information in a fairly condensed period of time. We'll put the link to the class evaluation in the chat box now. Please remember, if you, even if you're not going to be claiming CE, we really, really appreciate everyone filling out the survey because that helps make our offerings better in the future. So thank you so much for doing that. Completing this evaluation is the first step in claiming 1.5 MLA-CE credits for today's session. And I think that's it. Thanks on behalf of all of NNLM. Thank you to our representative from NTO for helping support this webinar, and thank you to Margie. And if y'all have any questions, please feel free to type them in the chat. Have a good day.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.